Good morning, hosts and organizers of the International Council of Psychologists 2022, my colleagues from around the world, and guests. My name is Olusheyi Lawoyin. I am the Chief Operations Officer at Watts Healthcare Corporation, a federally qualified health center that serves medically and socially underserved populations in South Los Angeles in the United States. Here are some data for you. At the end of 2021, 57% of the population that we serve at Watts Healthcare Corporation were at 100% or below the United States federal poverty level. What this means is that there was one individual living on $12,880 a year and a family of four living on $26,500 a year. I believe the discussion of health and human rights and what that means for global health equity by design is an important conversation to have and will continue to evolve as we tackle social ecological determinants of health. These are the historical, economic, political, social, and cultural factors that nurture or hinder health in one's environment. My work looks at the intersection of public health and international psychology, where at the micro level, I'm interested in the drivers of health behavior in an attempt to understand the perceptions of individuals towards healthcare and the health systems that serve them in their environments. As new knowledge evolves in different cultures and subcultures, and as people interact with one another, we're interested in looking at things like the impact of acculturation in this relationship with the health systems and how it shapes the delivery system to offer more equitable health and social outcomes. At the more broader macro level, there is an interest in how health systems function in their ecological environments and learning more about the contextual factors that drive system performance. And this is why I believe our topic for discussion is important. Health and human rights introduces context, and context matters. And this became even more pronounced and apparent during the COVID-19 pandemic. We're sort of emerging out of it, but the lessons learned from the pandemic will stay with us and will continue to be unearthed for a very, very long time. At the height of the pandemic, we saw the limitations and gaps in our health systems globally. Introducing new solutions to new and novel diseases or novel health complexities requires us to now think beyond the technical delivery of care. And what this simply means is that it requires us to think differently about how we deliver care beyond the four walls of an exam room, for example, or beyond a public health touchpoint where immunizations are administered. Introducing COVID-19 treatment and care options was considerably altered in its approach. You think of, think of the vaccines. You think of, treatment, medications that were offered to people who were either at risk or to prevent COVID-19. You think of your traditional approach to be a one-stop shop. You come in for your shot, you receive the shot, you leave, and you hope to remain well. The COVID-19 pandemic and the populations that we've served, we've seen that we have historically medically underserved populations where care delivery has to be aligned with a sincere understanding of history, culture, the social environment, politics, and socioeconomic status at the population level to ensure equitable and appropriate, the key word here is appropriate, delivery of care. This is going to be the new way of delivering care through the creation of intentional systems that really take into account the population and what their foundations are as it relates to seeking healthcare and receiving healthcare, as well as their perceptions of the health system. That's one part of the equation. The other part of equity is also looking at the health systems that serve populations we serve and strengthening them in their capacities to be able to deliver what we define as appropriate care. To conclude my message, there's a global call to action for health equity, but equity cannot be understood in a vacuum or be devoid of context. And this is the position of the case study I hope to discuss further in our roundtable session. Looking at psychological science to understand healthcare delivery in context is really, really important to support equitable health outcomes. And I look forward to the discussion along with my distinguished co-panelists as we address this in today's world. I wish you all the best. Thank you again for your time. Please have a great rest of the conference.